Dive into the world of medicine with the Patient's Guide podcast, where we simplify the science and uncover the research behind medical topics.
Welcome back to the Patient's Guide, where we break down complicated medical topics.
Yeah, we try to make health research easier to understand.
So you can make better decisions.
About your health.
Exactly.
Today, let's dive into a new study.
Okay.
About neck pain and when you have surgery.
Interesting. It's all about that procedure. What is it called?
Anterior cervical discectomy and fusion.
Oh, yeah, ACDF.
Yeah, ACDF.
Sounds kind of scary.
It does, but basically it's surgery on your cervical spine, which is like your neck.
So, like, if you've had neck pain for a long time and nothing's helping, physical therapy and meds, the whole 9 yards.
Injections, too.
Yeah, and you're still hurting.
Then ACDF might be something to consider.
Okay.
And this study looked at, well, they wanted to see if the longer you wait to have the surgery, the longer you have symptoms, does that affect how well you get better afterwards?
That's a great question because, wouldn't you think that the sooner you fix the problem, the better?
This study really looked into it. They looked at 9 other studies, actually, over 1,500 patients.
So they have a lot of data.
It's what's called a meta-analysis, where you take the results of all these different studies.
You combine it.
Yeah, you combine it to get like a bigger picture of what's going on. And what they found was people who waited longer than 2 years before surgery, they didn't get as much better in some areas, particularly neck pain.
Interesting.
And how much that pain kept them from doing normal stuff.
So waiting longer for the surgery could make your recovery harder.
Yeah, that's what the research is suggesting. It's not that people who waited longer saw no improvement. It's just it wasn't as much improvement.
Got it.
As the folks who got the surgery sooner.
This makes me think about this term I've heard in medicine, the minimum clinically important difference.
Yeah. MCID.
MCID, yeah, that's a really important concept here. So think of it like you have a little improvement in your pain score after surgery.
But it's not enough to actually feel a difference.
Yeah, exactly. MCID is the amount of change needed for you to actually feel it.
In your daily life.
Yeah.
In your life, yeah. So even if the surgery technically works, if you're not hitting that MCID level, you might not feel better.
Right. And this study hints that waiting a long time for ACDF could mean that even if the surgery is successful, you might not feel a positive change. So it's really important, this research. It suggests that timing could be a big deal when it comes to ACDF.
So what does this mean for someone who's had neck pain for years? Do they need to rush to get surgery right away?
No, not rushing. It's about talking to your doctor. If you've been struggling for a while, bring up ACDF with them. And I guess part of that conversation would be figuring out, how your neck pain is affecting your life, right?
Yeah.
This study mentioned something called the Neck Disability Index.
The NDI, yeah.
NDI, what's that?
It's basically a questionnaire. It helps doctors understand how much your neck pain is, getting in the way of daily life. Like how easily you can turn your head, lift things, or even sleep.
So it's not just about the pain level, it's about what you can't do because of the pain.
Yeah, exactly. And this study found that people who waited longer for ACDF, even after surgery, they didn't see as much improvement in their NDI scores.
So even after the surgery, they were still having trouble with, everyday activities.
Which supports the idea that doing something about it sooner could lead to better results. Chronic pain for years, your body kind of adapts.
Right.
Your muscles get weaker, your posture changes, even your brain, how it processes pain, it's all affected.
So you're saying even if the surgery fixes the physical problem in your spine, it might not be able to undo all those other things that happened over time.
Exactly, and it really shows why early intervention is so important. The study also used another way to measure pain, the Visual Analog Scale.
Okay.
VAS.
VAS, how does that one work?
It's pretty simple. It's just a line with no pain on one end and worst pain imaginable on the other.
Mm-hmm.
And you just mark where your pain is on that line.
Oh, so it's like a snapshot of how much pain you're in right now.
And the study, it found that people who waited longer for ACDF, they showed less improvement in their VAS scores, both for neck and arm pain.
Even after the surgery?
Even after. So yeah, they might be dealing with pain in both those areas still.
Wow. So this really emphasizes how important it is to get treatment early on.
It does, but it's important to remember every patient is different. This study isn't saying everyone who waits longer for ACDF will automatically have a bad outcome.
Right. It's not a guarantee.
Exactly. And it really emphasizes the need for personalized care. You and your doctor, you have to talk about your specific situation, weigh the benefits and risks of surgery together.
And talking about a more holistic view of your health, I noticed this meta-analysis also looked at something called the short form 12, SF12.
That one is another questionnaire, but it's more about your overall quality of life.
So it's asking about things like how you're feeling mentally and physically.
And what's interesting, the study didn't find a big difference in SF12 scores based on how long people waited for ACDF.
So even though people who waited longer may not have seen as much improvement in their pain or ability to do things, their overall quality of life wasn't necessarily worse.
Yeah, it's kind of mixed, and it's hard to say for sure from this specific finding. Quality of life is a complicated thing, lots of factors beyond just physical pain.
I guess it could be that people who waited longer for ACDF, maybe they found other ways to cope or manage their condition.
Or maybe they just had different expectations going into surgery and were more satisfied with the results, even if they weren't as dramatic as those who had surgery sooner.
It's a good reminder that our physical health and mental health are really connected, and how they both play a role in our overall well-being.
Absolutely, and it reminds us that there's more to think about than just the numbers on a pain scale or a questionnaire.
So much to learn about the spine and how to, treat these conditions.
Studies like this one, they give us these pieces of the puzzle, help us understand better and treat patients better.
So what if someone's listening to this and they're thinking, okay, this is me, I might need ACDF, what do I do?
Well, the first thing, always talk to your doctor.
Right.
They'll look at your situation, your medical history, your symptoms, what you've already tried,
Right.
and then they can tell you if ACDF is even right for you. And if it is, they'll explain everything, answer all your questions, make sure you're comfortable.
Yeah, this has been really interesting. It seems like timing is a big factor with ACDF.
Yeah, it's definitely something to consider. And with any research, we need more studies to really confirm these findings and understand all the details.
Makes sense.
It's a complicated issue.
We've covered a lot today, but we always tell our listeners, keep learning, stay curious. We've got links to the studies in the show notes if you want to dig deeper.
And remember, every patient is different. What works for one person might not work for another.
Right.
It's about finding the right treatment for you, working with your doctor.
Thanks for joining us for this deep dive into neck pain and surgery.
If you enjoyed this episode of The Patient's Guide, you can find more below.